Welcome to this Part B overview of the Certified Professional Patient Navigator exam, sponsored by the Patient-Centered Education and Research Institute. I am Brian Daly with the Institute, and in Part A we discuss the content of the CPPN exam. In Part B, I will be presenting information about the format of the exam and provide hints that will help you maximize your scores. We definitely want to maximize your chances for success. In Part B, I will give you examples of the questions in each of the two assessments that make up the exam. First, I'll discuss the MEIQ CPPN Emotional Intelligence Assessment format and offer ways to use its immediate results. And secondly, I'll discuss the core competency assessment format and explain some of the factors that shape the various questions. Finally, I will provide you with information that will make it easier for you to navigate successfully through this process. The MEIQ CPPN, the Emotional Intelligence Assessment, is a standard psychological exam. We were seeking a testing regimen to measure emotional intelligence, and we recognized two important factors. First, emotional intelligence is not easy to measure, but significant research has been done to help determine what types of questions provide reliable and valid measures of emotional intelligence. Our assessment contains the two predominant question types beyond direct observation by a psychometric professional. We use both self-reported belief scales and your observational skills. The belief scales ask you to rate your perceptions of your skills and preferences. The observational skills questions are asked to help you determine what a picture or a description is saying about a particular situation. Now, there are no right or wrong answers, but your self-reported observations do reliably predict your emotional intelligence sensitivity. The second item is we want you to know more about yourself. We strongly believe that participants in an assessment should be provided with detailed descriptions of their emotional intelligence strengths and weaknesses. We want to provide you with a pathway to improve your perceptions and ultimately to improve patient-centered care. This assessment accomplishes that factor too. There are 115 questions in this assessment, and we use a variety of self-reported strengths and weaknesses to understand your starting point. Next, we use different scenario questions to assess your sensitivity to certain clues in situations and depictions of events. These two elements then provide you with scores on 20 emotional intelligence competencies that are further grouped into 4 dimensions that are further combined to assign an emotional intelligence score. The reported scores include ways to improve your emotional intelligence even further. It is truly a self-help tool. Let's take a quick look at the 4 dimensions of the test. First is your ability to characterize your emotions and recognize those of others. Second is your willingness to use your feelings to constructively build better relationships with others. Third is your skill in analyzing emotions and using your understanding to solve emotional problems. And fourth is your ability to take responsibility for your emotions and effectively manage situations in which you find yourself. Now, having strong emotional intelligence makes you a better person and improves the level of patient-centered care that you provide. Your understanding of these 4 dimensions improves your professional and personal capabilities. So, let's look at some question types in this field. About half of the assessment involves scale ranking questions where you rate yourself on how much a phrase, belief, or skill applies to you. Again, there are no right or wrong answers. It's based on what you perceive to be most descriptive of yourself. The goal is to identify what you think is important and not important. You cannot study for these questions. We are seeking to profile your likes, dislikes, and preferences. These questions help determine how well you know yourself. The other type of questions used in the MEG CPPN assessment are scenario questions that use either verbal descriptions and pictures to assess your perceptiveness. In each question, there's a description or a picture, and then you are asked to project what you see or perceive to be the situation. Again, there's no one right answer. Each of us, perceives things differently based on our experiences and environments. And so your answers, again, provide a proclivity profile that is unique to you. So here's another quick example. What do you see in the picture on the left? What is that photo telling you? Now, some I think will see maybe a teenager chilling after a tiring night. You can tell by the food being left there, the weight system, the clothes strewn about. Obviously, the very much asleep teenager. Or someone else might see, well, that's a physician who's just crashed after working a double shift at the emergency room. They've come in and they've just literally collapsed. Or someone else might say, well, it's a drug addict who's overdosed. We each see things differently, and the challenge is using all our formal and informal tools to help reach an answer as to what is happening. Your emotional intelligence, your ability to empathize, your ability to use all your skills to find answers lead to better relationships and more effective patient-centered care. And that's what it's about. Okay, we finished the MEIQ, emotional intelligence, and then we come into the competency assessment. And what I want to make sure you understand is that there are questions from emotional intelligence, from other areas in the competency assessment, for instance, ethics. So what we'll be doing in this second component is an assessment of your professional competencies from whatever area they come from. We collect data on this through several question formats. So let's look at some of the question formats. Evaluating the competencies takes a variety of question types, and so we'll be looking at multiple choice, matching, case studies, scenarios, maybe even a combination of some of all of the above. As in many automated exams, multiple choice questions are used to make scoring simpler. This particular example asks about your understanding of the role and scope of practice of a lay navigator. There's one right answer, although some answers may be partially true, but they don't fully address the questions adequately. You must find the best answer out of the choices. And just very quickly, looking at this example here, one of our key factors that we talk about in lay navigators is that they don't have clinical care duties. So by knowing that, I can go through the questions and say, oh, okay, there's only one here that doesn't address that factor, that doesn't say that clinical care is part of my job. So obviously that would be the correct answer. So those are the kinds of ways to get through some of the questions. Another type of question are those that require you to have specific definitions in mind, that you know about certain things. So this happens to be medical definitions. In this question, there is a clear distinction and only one correct answer, and probably nothing that's close to being correct otherwise. So there are several questions like that in the exam. Here is a multiple choice question that approaches it a little bit differently. It's asking for a negative response. Notice the not underlined. So which of these is not a state responsibility in public health care management? Don't be tricked by the wording of the question. One of our more challenging question formats are those that require matching. If you miss one component, you're likely to miss two or more of the others. So in this example, if you are unclear about one part of Medicare, you may miss other components as well. And then finally, we have case studies and scenarios, and these are, again, challenging. Only scenarios or case studies may have several questions asked about it, so that you may have one situation, but you may have multiple questions. If you fail to read the situation correctly, you may miss multiple questions. The challenge is to use your judgment to sort out the situation and select the best response. In this example, there are several partially right answers, but only one is best. From a patient navigation perspective, A is the correct response. Problem solving is embedded in most case study questions in the CPPN exam. The CPPN exam is not easy. It requires an understanding of patient navigation, healthcare systems, public health, community health resources, insurance, patient-centered care, emotional intelligence, and numerous other skills. If you're experienced in healthcare, you may already have a lot of the skills needed. The resources on this page are especially useful for those who want to take the exam. In addition, there are courses available through several organizations that will prepare you. Our Patient Navigation Professional course is one of several that would help. Let's explore some other helpful hints. Over the years of development of this particular exam, we had some very specific assumptions that we had, and I think it's important that we discuss those. First, we designed the exam to test the 46 competencies of patient navigation professionals. So our focus was on those core competencies. Second, we designed it to test the basic skills of patient navigation professionals who are not necessarily clinicians. It is designed for lay navigators, although nurse navigators will find it useful. The same skills are needed by both groups. Third, we assumed that the navigator or advocate would be part of a healthcare team or would be working for a healthcare provider or hospital and in some way serving as a patient advocate in a structured system. Okay, let's take a look at some of the stuff you just need to be aware of. This is an online exam. There is no penalty for guessing on questions. So if you're unsure, take an educated guess as your best option. The MEIQ emotional intelligence test does not require any preparation. Show up, take it. You will take that test first, and then you'll be followed by the CPPN competency exam afterwards. And the competency exam has 5 sections, and you'll take each of the 5 sections independently, and you'll have 45 minutes to complete each section. Most of the questions require some critical thinking, so memorization is not going to be too helpful. Most questions have 5 answer options, which would indicate to me that it's a multiple choice test in a lot of the sections. You must complete the 5 exam sections within 7 days. Each one of those is separate, remember, and you have 45 minutes for each one, but you have to complete them within 7 days. Schedule uninterrupted time for each section exam. Now, you can take all the exams at one time if you so choose, all 5, not counting the MEIQ, emotional intelligence test. That one in particular will take probably about an hour. But again, it's a separate exam and it doesn't count in this particular scenario here. Once you start a section test, you must finish it in one setting. In other words, as you sit there that one time, get it finished. If you don't, then we've got problems. You must pass all the section tests to complete the exam. So if you fail a section, you will have to take that part over again. When you complete a section and you submit it, your section test score will display so that you'll know how you're doing. You can take a section test again if you get below a 70. And if you have a connection problem, we can reset it for you. We can get you started again. Retests and resets will normally take 48 hours. And if you fail the CPPN exam, fail more than a couple of sections, you can reapply after 6 months. After you successfully complete the two-part CPPN exam, you will receive a certificate that designates that you are a certified professional patient navigator and that you can use the CPPN designation. We will send you a PDF version of the certificate and a printed copy for display and add you to the National Registry. As a condition of maintaining your CPPN, you must complete 15 hours of certified healthcare training each year. Most professional healthcare continuing education courses are applicable. An annual certification recertification includes submitting your continuing education completion certificates, copies of them, and a $30 annual renewal fee. In this and a previous video, we've covered the content and structure of the exam. If you're interested in applying for certification, access the certification page on our website and complete the application steps. We hope this information is useful to you. Please feel free to contact me at bedaily@patientinstitute.org if you have any questions. The CPPN designation is proof that you have the skills and attitudes of an effective patient navigation professional, and I hope you give it a try.